Breaking the law is not something surgeon Dr. Ellen Farrokhi normally would do, but when a man's life was on the line, she decided it was worth the risk.
I was in the hospital just doing our usual morning rounds, and I got a call from the emergency room doctor who said he had a patient with severe back pain and a very low blood pressure and was worried that it was an aneurysm that had ruptured. I stayed around the emergency room and asked them to get the CT scanner clear, and we followed him in there, and I watched the CT scan unfold, and it did confirm, in fact, that he had an aneurysm in his stomach, which was ruptured. There was actually some blood you could see in the stomach as well.
I got the call from George to see if I could look at some images. I happened to be there, so I walked down to the CT scanner where they were. I saw the aneurysm, and I immediately knew that we had to work fast on getting things measured out if the stent graft could be put in, and decide on whether it's going to be an open surgery or a stent graft surgery.
Prior to the CT scan, once I saw the patient, I called our surgeon, Dr. Farrokhi, and alerted her that there was a patient I thought had a ruptured aneurysm.
I was on call. I live in the Seattle area, and my PA called me just as I had served myself lunch. We're just about to sit down, and he said, "Ellen, I have a man who I think has a ruptured aneurysm. His blood pressure is 60 systolic, and he's so ill, we don't have any other vital signs." Given the urgency of the situation, I live about 28 minutes from the hospital, but I knew that this man didn't have a blood pressure, and so he was very close to death. I wasn't sure he was going to survive even the 28 minutes that it would take me to go from my home to the hospital. So I got into the emergency lane, and I made the decision to drive 80 miles an hour, understanding that the speed limit is 60. However, I thought I had a very valid reason to speed. In the midst of the drive, I was speaking to members of my team who were physically taking care of the patient. In the middle of the conversations with my team, I noticed that there were some flashing lights behind me. So it was a cop noticing my excessive speed at 80 miles an hour. So I was very concerned still that I needed to make it to the hospital, so I called 911 thinking this would be great. I could explain the story. So I called 911, explained that I'm a physician, I have a dying patient, I'm trying urgently to make it to the hospital to save their life. Would they be able to speak to the cop who's behind me and let he or she know that to escort me to the hospital and give me a ticket at the hospital? At that point, I really weighed the decision, what should I do? Should I pull over and potentially add to the delay, or should I keep going? And I decided to keep going. I had 911 on the phone. I stated myself, I thought soon enough this man will see that I'm at the hospital and we can resolve this issue. However, he had called for backup. And so not only then did I notice one flashing light behind me, but there were flashing lights around me. And at that point, I decided the smartest thing to do would be to pull over. So I pulled over to the side of the road, at which case all of the state troopers got out of their car and proceeded to have an argument about whether they should let me go or not. I did what I think any other person in the situation would do. Was I got in my car and I proceeded to speed as quickly as I could to the hospital. And I arrived there, and the patient, actually the team had done such a wonderful job that when I got there, the patient was prepped for the operating room, on the operating room table awaiting surgery. Because the anesthesiologist had not put this patient to sleep yet, I had a very brief moment where the man had a towel over his eyes because the lights were so bright. And I lifted up the towel and I asked him, "Sir, my name's Dr. Farrokhi, and you have a ruptured aneurysm. The team and I are going to work very hard to save your life today. If we don't, is there anything you'd like me to tell your wife?" And he said, "Yeah, Doc, tell her I love her." And I said, "You got it." And Dr. Derek intubated the patient, and Dr. Crushy and I then did the operation, and we did it successfully, and the patient survived.
And knowing what this gentleman had, and that we, given the extreme of his situation, the fact that we had a chance to save him, absolutely. I think any of us in that situation would do the same thing. Yeah.
Nobody had any idea that this was going on. I think she was very tight-lipped about the whole police chase until after the surgery was done and we knew the patient was doing well. It was a very minor point in her day. Her real concern was taking care of the patient.
Absolutely, I would do it again. And I don't know, yes, I would speed again. Absolutely, I would speed again.
I think I waited at least a day before I started cracking some jokes, but I did tell her to be careful on the way home and not get flanked by the state patrol, so that was, yeah.